Applestosen. It's Dr. Bob here with another health and vitality solution tip of the week. So a lot of patients will come into my office and they've already been on the internet and they have already diagnosed themselves with what they think is carpal tunnel syndrome. Carpal tunnel is the bones of the wrist are called the carpal bones, and the tunnel where the median nerve goes through is called the carpal tunnel. So people that are on the computer a lot, doing a lot of extension with the wrists and a lot of repetitive work can create a carpal tunnel syndrome. However, a carpal tunnel syndrome specifically works a very specific nerve, your sixth nerve in the neck, which is your median nerve. And it actually affects this part of the hand, the thumb, the index, and part of the middle finger. So if that hand is going to sleep and maybe there's a relentless pain at night, it could be a carpal tunnel syndrome, but it could be a lot of other things also. The thing that's distinct about carpal tunnel is that it is a double crush problem, meaning that there's a nerve in the neck, the sixth cervical nerve, that goes down, the median nerve, and goes through this tunnel and into the hand. Now, a lot of muscles and through the wrist can actually create trigger points that can do that. There's problems through the shoulder, problems in this chest muscle that can also create some of these symptoms. So it's important that the diagnosis is not to just go into a carpal tunnel surgery, but relieve the pressure on the nerve or the circulation to that area. As a chiropractor, obviously you have to make sure that your posture is corrected. If you have a carpal tunnel problem and all you do is go in and do surgery, it's kind of like trying to get water out of the end of a hose and the water's turned off. So you've got to make sure that the nerve supply in the lower cervical area is allowing the nerve supply to come from this area down into the hand. So a couple things that we want to look at first is the best thing to do is take a x-ray of the neck and potentially evaluate certain orthopedic tests of the wrists. So certain positions of the wrist can actually aggravate it if it's carpal tunnel syndrome. But what we find in 30 years of practice is that if the neck is properly lined up, if your posture is in good alignment, and the lower discs are in good balance and order, and the head is centered over the body, you don't actually develop a carpal tunnel syndrome. So if those are problems, your head is jutted forward and you've got this shift going on or a shift to one side and you've got repetitive strain, you need to correct those first and allow the body to heal. In conjunction with making sure that the neck is in proper alignment through proper adjustments, you want to make sure that the stretching of these muscles and strengthening the back muscles along with muscles in through the wrist. So we do a lot of closing of our hands, but very little do we open. So there's a couple ways to do that. You can actually do specific movements of the thumb and the little finger, but the best one is to take all fingers and you're actually going to open it up like a claw. And that motion creates an opening of the little tunnel called the carpal tunnel syndrome. So this type of motion creates a strengthening of these muscles that need to be worked, your extensor muscles, which go down into the arm. So working these areas out, strengthening it, aligning the neck, correcting the posture, stretching the chest is really the treatment is necessary. If you're having problems at night with sleeping, it's okay to actually wrap the wrist. You can get this elastic sports tape and you can put one band, you curl the wrist and you put one loop right around the wrist itself. That creates this carpal tunnel right below the wrist bones. It gives some stability to the tunnel itself but allows better circulation. The worst thing I see is that people put in a cock-up splint or they immobilize it. You need movement and motion to the area, but if you need some stability to the wrist, if you're having a problem at night, just right below where your watch would be is a great place, and this is an elastic tape. I've had some people actually use electrical tape, but this elastic-on tape is a sports medicine type of tape that can be purchased at any Rite Aid or a drugstore. So carpal tunnel is a diagnosis that is something that a lot of people come in, they assume they have it, they assume that they need a surgery, and yet they don't actually correct the underlying problem that got them to that point. So let's work backwards, allow the body's innate ability to heal by taking pressure off the nervous system, correcting your posture, stabilizing the wrist, balancing the muscles, and the body can heal on its own. As a chiropractor, our main focus is to remove stress on your nervous system. So the tip of the week is on carpal tunnel syndrome. So if you have problems in through your wrist, make sure that you see a corrective care chiropractor to make sure that they're looking and evaluating this to make sure that you don't end up with an unnecessary surgery. Until next time, it's Dr. Bob, Applestosen.